Greeting you all as we come together for this open online briefing. Just like to recognize one or two people for whom I think this might be their first. First of all, hello to Joe Nichols, who's working in Somalia and in Kenya and living in Kenya. Joe, who worked with me very closely on Ebola. It's lovely to see you, and thanks for sparing the time to join. To Jason Gale, with whom I worked on avian influenza and many other things, and now is producing some extraordinary material for Bloomberg and kindly sharing them. And I was just reading, Jason, this morning, some really important material that you produce from right across the world. So grateful to you. Welcome to Lena Mahi. Welcome to David Salinas. Thank you for joining. Paul Rushton, nice to see you again. Marianne Hasselgrave, great that you're here. Hello to Dara. I don't know whether you've been on before, but if this is your first time, welcome. Rausana, thank you for coming, and Nancy Medley. What we're going to do today is I'm going to go through with you quite a set of quite high-level points about what I'm seeing now as countries are trying to come to terms with their COVID outbreaks and looking forward into the coming few months and years. And just do it, I'm going to do it in quite a structured way today, it'll be like a sort of COVID tutorial, but I'm going to try to illustrate each of the themes with one or two observations. Then I will stop a little bit quicker than usual, and then we'll go into the opportunity for discussion and use the discussion with you sending in your questions on the chat line so that we can expand on some of the themes. Now, the themes I'm covering today will become themes for our next narrative. And also, I've got some quite interesting media moments coming up at the weekend. So in part, this is thinking through my themes for something called the Andrew Marr Show on the British television on Sunday morning, if it works. You know, these things, they can be planned, but they can go wrong. But that's the current plan. So let's see how it goes. They're going to be 5 headings, and I'll be pretty clear on what they are, because as you know, I don't like using slides. It just distracts things. Within this, I hope that we will then have some points for the conversation. I'll just give you the headings first. First of all, I want to focus on the massive risks that I believe are posed by this virus, and continue my point that the virus must not be underestimated under any circumstances. Secondly, the vital steps that all nations need to put in place to be COVID ready. And by, I don't just mean nations, i.e. governments, I mean the people of all nations need to put in place. Thirdly, I want to highlight some of the false choices that are being put around a lot when people are debating which aspects of the vital steps to be put in place, and portraying to their people some of the policy choices they're making. And I think there are elements of those choices that are just not right. Then I want to go to my fourth point, which I call inequities revealed, how COVID actually is exposing existing fragilities and inequities in many of the systems that we've got used to in our world. And you know, it's up to us really as a society to decide what we're going to do now that these inequities are becoming very clear. And I'm going to pick out one or two for more detailed debate, but that's going to continue to be one of my themes, as some of you know, for the coming weeks. And then the fifth is what I call real opportunity. Just there is an extraordinary opportunity for people obviously in decision-making roles, whether they're in government or local authority or business or other walks of life, to actually do stuff that makes life just better, not just for now, but looking into future. And that you'll probably hear me just dwell a bit on that. So just on the massive risks, I have seen nothing in the recent weeks to actually lessen my view that the novel coronavirus is extremely dangerous. It's stealthy in that it can build up to explosive outbreaks very, very easily without people realizing. And even when you think you've pushed back the COVID, as we saw in Germany or in Singapore recently, it comes back, bam. And I think just about every country that's succeeding in their pushback attempts, like New Zealand, or states like Alaska or Hawaii, or countries like Austria, I think they're conscious that this will come back and they're going to have to keep their defenses strong. It's a surprising virus. Look at the material that, in fact, Jason was sending me an article about this morning about this surprising hypersensitivity reaction in children. It's rare, but, you know, suddenly having said that this thing doesn't really seem to have much impact on children, we've got a syndrome appearing that's going to be very worrying indeed, because it's an extra threat for people who are already perhaps anxious about their children. And I think we're going to find that there may be certain groups of children that are at particular risk. And most importantly, as we heard from Mike Ryan yesterday, head of the Emergencies Programme at WHO, this virus is here to stay. And I know that you're all reading how in the United States, they're anticipating that a Sanofi vaccine will be available at the end of the year, and there'll be 300 million doses. But I just want to say, again, paraphrasing what Mike Ryan said, you know, it's one thing to have a vaccine, even quite a lot of vials of a vaccine, but it's another thing to make sure that everybody gets it. And Mike was reminding us that having had huge progress with measles immunization, the world is now working backwards, and there are kids really sick as a result of measles. We've got problems with polio still, and there is a great deal of vaccine hesitancy around the world. So it would be just wrong for governments to be basing their policies on the inevitable arrival of a vaccine in the near future. So this, just keep recognizing that there are massive risks associated with the virus. And of course, if we push back the virus and decrease the morbidity associated with it, then there will be people who say, oh gosh, this effort to contain COVID, it's completely unnecessary and we're getting deaths from malaria or other conditions. But that's almost, again, coming to one of these difficult comparisons, because if you're successful in pushing back your COVID, of course you'll get very few cases. But the point is, if you didn't push it back, then you get the kind of explosive outbreaks that we have seen in northern Italy or New York or Wuhan. And so we're going to have to keep going with our communications straight. This is a very dangerous, stealthy, risky virus, and we have to put the efforts in to contain it. And those are good for the rest of public health. And indeed, what it's showing us is that we really have to invest more in health. So I want to keep this line of dangerous virus going as much as I can and making that point regularly. Number two is what I call the vital steps. Here I'm very much influenced by my colleague who used to work with me closely on Ebola. That was Bruce Aylward, he went to China with WHO in February. He's been in Spain a lot recently, but he's actually very closely involved in what's happening in many other countries around the world. And he says, let's just be absolutely clear. If there is COVID, that the really important thing that any area needs to do, whether it's a state or a nation or a region, the first thing is to keep infection levels down as low as possible. And that is by interrupting transmission. And we'll come to more about interrupting transmission in a second, but got to keep your numbers down as low as you can, because as soon as they start coming up, you know about exponential spread. You know that if you get 10 cases today, it can go increase 8-fold in a week, 40-fold in 2 weeks, 300-fold in 3 weeks, and then more than 1,000-fold in 4 weeks, and then tens of thousand-fold in 5 weeks. The problem just gets really, really big if you're not keeping those numbers down and being very robust about it. Getting that across to decision makers as being part of the vital steps of early action to keep your numbers down, so important. Second one is testing. Now, we all know that PCR testing is tough. and that scaling up PCR testing is really difficult unless you've got very highly automated machines, and not many countries have got them. So it's a tough job, and I'm very much looking forward to new virus tests coming available. Virus tests, I keep insisting. But for the time being, getting the testing numbers up and keeping them up and making sure that the tests are reliable and you haven't got lots of false negatives is really important. If you haven't got tests, then you have to do your best without them. And that's the case for so much of the world. Thirdly, super important, contact tracing. You want to stop the spread of this virus. It's not enough just to isolate individuals with the disease. All the evidence from Germany and other countries is that you've got to have the contact tracing in place. And fourthly, is making sure that your health services are able to work and function, even if you're dealing with outbreaks of COVID. All these lessons come from East Asia, really. I mean, we keep going back to the Chinese experience because it is powerful, but also it's the experience of Singapore, it's the experience of South Korea. And we have to add in one more vital step to this, therefore, which is that if you do get an outbreak, you can move quickly with a public health SWAT team and close it down, stop people moving out of the area, isolate those who've got disease, and that capacity is going to be a key part of what I call being COVID ready. These are the vital steps, and I want to go on and go on and go on talking about it, because then I come to heading 3, the false choices. False choice 1, which is in just about every country and every public discourse at the moment, is public health versus economy. Either we keep the people healthy or we keep the economy going. And then you get the argument taken further. If we go on trying to focus on public health, then we will damage the economy. Well, I don't think that's actually a choice. Actually, I think it's public health and the economy. And many of you have heard me say this before, but I seem not to be communicating my message very well, because the public discourse, for example, in the UK or the US or in France or in much of the rest of the world, perhaps not so much in the poorer countries who actually seem to be able to get it so well, but the public discourse, certainly around here where I am, is always, we can't go on crippling the economy because we are working on public health. And in this debate between the president of the US and this senior wonderful man in his health task force, Anthony Fauci, is so often presented as a binary choice, but it's not. For the economy to be strong, public health has to be good. Every business leader knows it. The more I listen to them, the more they're telling me. And so getting those vital steps that are public health elements in place and making sure you've got a honeycomb of capacity across the community to do the case finding and contact tracing with the testing at an adequate level is just an absolute necessity for maintaining the economy, maintaining employment, maintaining the social fabric of society. And if you don't get the public health right, the economy is always going to be sputtering. And, we just have to ask our friends in the Republic of Korea, who've had a return of the virus in quite a big way as a result of activity in nightclubs and so on. But they are dealing with it as part of their public health strategy. We had the opportunity just a couple of days ago to listen to Foreign Minister Kung Wah Kang explaining it very precisely. You can't have one without the other. And ditto in Singapore, where our friend Dale Fisher is doing such an amazing job together with many, many others in the country, and Professor Chung, who has always been so strong on this stuff. Singapore will be strong if it can maintain public health, and because they've got an outbreak of COVID in one of their worker dormitories, they know they've got to close it down with proper isolation, with proper case finding and contact tracing in order to keep the economy going. It's, in a way, for me, it's blindingly obvious. And of course, I keep saying it, but somehow, it's just not there in the public debate. Perhaps it's convenient for people to present it as a binary choice, but it doesn't make sense because it has to be both. Anyway, I feel a bit blue in the face saying it. The second binary choice that I feel is a false choice is surveillance versus liberty. Liberty will come through having capacity to maintain public health. But capacity to maintain public health will involve a degree of surveillance. It's going to be inevitable, because otherwise you cannot do contact tracing. If people insist on being anonymous, insist on being able to hide, refuse to use some of these smart apps, then surveillance will be super hard, and contact tracing will fail, and then, there will be no liberty. So again, I think that's another false choice. And I have a few others as well, but I won't waste time with them now. I just think keeping going on the false choices, keeping the narrative right so that it's not always presented as binary, is so important. I come to inequities revealed. This is when it gets tough. And this is when I think we're going to have some struggles in the coming weeks and months. Let's just start at the beginning of, it is really hard to contain COVID, to interrupt transmission in very dense settlements, whether it is a foreign worker dormitory or the dormitory in a meatpacking plant or a ship's quarters where you've got people very close together, and in particularly the crew quarters, and most importantly, in a slum. And so I talked to colleagues in India working in Dharavi, which is the slum in Bombay. People who've not been in India will know about Dharavi from a film called Slumdog Millionaire. But Dharavi, in the film, you kind of, in the cinema, it sort of looks romantic. It's not a romantic place. And it's very, very dense housing. And there is a quite intense COVID outbreak raging in Dharavi slum right now. And the municipal authorities in Mumbai are doing heroic efforts to try to contain that outbreak and try to isolate people with the disease. But isolating people within a slum is super hard. And so actually in India at the moment, the COVID is in New Delhi, in Ahmedabad, in Mumbai, in Chennai, and in a few other of the cities where people do live in dense population. It's not in the villages. Out of the 700 plus districts in India, about 400, I think, are free of COVID right now, or thought to be, and they've got very widespread testing in India. It's concentrated in these dense urban populations, and it's got in there, actually originally coming from air travelers, but it's found its way into the slums, and it's hard to get out. And so we're finding the same story in Latin America, in the favelas of Sao Paulo, in the favelas of Santiago and Buenos Aires. And it's again proving very hard to dislodge. I mean, it's also in other parts of Latin America. I don't want to pretend that it's only in the slums. But this phenomenon of COVID being in densely populated areas creates a real challenge. And when I say inequities revealed, what COVID does is it shows us and reminds us the appalling conditions under which certain people are living. It also reminds us, as I've hinted at already, about the appalling conditions under which people are working. There's an enormous epidemic of COVID in meat processing plants all over the US. You just have to look at the newspapers, search on meat processing and COVID. Some of the best known names of meat processing in the US are having to cope not only with a lot of COVID and unfortunately people dying because they've got diabetes or because they've got hypertension and they get their COVID through work, but also what it then turns into, because the president of the US, realizing that the meat industry was in difficulty, ordered the meat industry to continue working despite the fact that many plants were having to struggle with COVID because meat was a national security issue. But it's not just in the US, it's in Canada, it's in Australia, it's in Ireland, it's in Poland. We think it's in some places in France, though the French say that they do slaughtering and meat processing better than anybody else, but it is there as well. It's definitely in Germany, to the point where Angela Merkel has had to actually get very clear on the fact that this is exposing appalling conditions in the meat industry, often non-unionized labor, often working under really difficult conditions, often very low paid, working long shifts, extreme cold. So what do? They do a 12-hour shift or something, cutting up meat, slicing and stuff with saws on conveyor belts. Where do they go? They go to their rest quarters. They don't sit around. They lie down, and they lie down close together because it's cold. They want to warm up. And one of them's got COVID. Everybody gets COVID. Like the ships, like the naval ships, like the merchant ships, like the cruise ships, like residential accommodation. What's happening in Colombia right now? COVID in multiple prisons, causing riots, causing deaths, causing actually real problems for the people who work in prisons as well. So when I say exposing inequities, it's not so much inequities in terms of wealth, that they are, and I want to stress that COVID is now really, really causing problems for poorer people, poorer communities, but it's also inequities in relation to the way in which people are forced to live close together, often when they're powerless. A prison, by definition, is a place which is always overcrowded, where people are living many more to a cell than they were probably originally designed for. And if you get COVID for one person in the cell and there are 4 or 5 people sharing the cell, they're all going to get it. So it's really exposing inequities. And we can go further and say it's exposing inequities in food systems, because COVID control and containment means restricting movement. I mean, it's a crude thing to do, but if you are stuck with COVID in your population, the one thing you can do to reduce the rise in numbers of cases is just to stop people moving. And of course, that's called lockdown. And lockdown, under certain circumstances, when you've got an outbreak in a particular area, like in northern Germany right now, yeah, you stop movement. It's the obvious thing to do. But a whole country lockdown or half the world lockdown, like we've had recently and still going on, that's actually a crude thing to do, because you're basically saying, this is overwhelming. We've got to stop movement, build up our public health services, get our hospitals working, get PPE to our health workers. But in turn, you're actually making an awful lot of people unemployed, hungry, undernourished, damaging food systems, damaging the tourism industry, many, many other things. So again, COVID and containment exposes inequities in so many sectors, and always it's the poorer ones who suffer the most. So that fourth point that I was going to say about inequities revealed is actually the part that I am just stuck on most at this time, because of actually what COVID is doing is reminding us that we go about our lives, eat our meat, cope with the fact that prisons have to be there, but we don't think about them too much. And we also don't necessarily go into the details of the food system. And just suddenly COVID comes along and reminds us, wow, smallholder farmers are in difficulty. Poor people get hungry and their kids get malnourished. Prisons are horrible places, and they're worse and worse and worse because they aren't invested in. Migrant workers are living in appalling conditions, especially those working in meat, and more and more. And I perhaps come to the one that's the most extraordinary inequity that's been revealed, which is the conditions under which we're prepared to let older people be cared for. And I was in this, my mum spent the last few years of her life not very happy at all in a residential home for older people. She's dead now, but were she alive, she'd almost certainly be one of those current statistics of an extraordinary number of older people in residential accommodation who've died, because the infection control in residential accommodation, the conditions in residential accommodation for older people are not appropriate. And that has led to suffering. And the people who work in residential accommodation for older people, mostly women, doing extraordinary work, which I hadn't thought about until COVID came along. I hadn't thought about it. But actually they're doing extraordinary work, and they're paid next to nothing. Next to nothing. And the gig economy, doing multiple jobs. So inequities revealed plus like COVID. So much. And people like myself who prided ourselves in being concerned about inequity kind of have, I don't know, I've been asking myself recently, what on earth's been going on? I think I've just sort of become used to it. I've become used to the fact that slums exist, used to the fact that people who work in food are in appallingly paid jobs and exposed to awful, awful conditions. And I've got used to this older people, I think. Anyway, I'm talking too much because one more area of inequity is in hospitals. You know, hospitals in poor countries, people who are working in hospitals in poor countries, usually, again, women, not protected, not properly serviced. And now along comes COVID, a bit like when we had Ebola. They can't get their protective equipment because the protective equipment has gone to people in richer countries, and they can't even get N95 or FFP masks, and they can't get the other stuff. So inequities revealed is point number 4. And number 5 is turning it around the other way. If we can pay attention to what we're seeing through COVID, every one of us, and I keep using us because I do put myself in this category. I see myself as a responsible public health person. Every one of us working in public health, in public life, every one of us who wants to lead and lead for a better world have an extraordinary opportunity. I think not just a once in a lifetime opportunity, it's much more than that. This is an opportunity like never before to actually take advantage of the revelation of inequity that comes through COVID to do something much better. I'm not going to say build back better. I'm going to say to leap forward better. It's nothing to do with going backwards. It's to do with going forwards. It's in line with the stuff that we all worked on over the last few years, the 2030 Agenda for Sustainable Development, which contains all the elements that are really necessary for creating a just, equitable, and sustainable future for our planet. All the elements for making life that's better for coming generations. And that real opportunity is there now. And I'm not going to say that it's going to be golden and beautiful and everything's going to come right. I'm hopeful it will. I'm not going to say it for certain because so much depends on what happens over the next 3, 6, 9, 12 months. It's going to be quite a long time because the knock-on effects of all this COVID, they're not going to suddenly disappear. And anyway, the virus isn't going to disappear. And anyway, we're not going to have a vaccine for a number of months or years. So we've got quite a long time to work it all through. But we're going to have to, as we make sense of this, whether we're in leadership positions at the top of something or leadership positions at our own home or in our NGO or in our university or wherever, it's a time when making sense of this can mean that we re-equip ourselves to just look at these inequities that are being revealed, to look at these inadequacies in our way of working that are being revealed, and then to say, A, we'll get the COVID right and we'll do it in a way that's equitable and just, and we'll also use that same energy on nature, on climate, on migration, and on other issues that are just so awful in our world as it is now. So those are my opening remarks. I kind of, this, as I say, was new thinking, came out really over the last 2 or 3 days trying to structure it in that way. So it's different from the last 1 or 2 online briefings. Some of you who've been at the previous online briefings will recognize that there are elements in there. And so now what I'd like to do is to go through, just as I usually do in the briefings, just to remind you of who we are and why we're doing this. I'll do that fast. I don't want to take up time. I'll also say that as well as answering your questions, if anybody does feel like just making a couple of remarks to either reflect on what I just said, many of you are people I know who worked in public health. We've been connected over the years. I very much like to open the mics and we can do that. But please just tell us from the chat line if you feel you want to speak, and please do it relatively briefly. Just say the team, just remind you, there are currently 9 of us working in 4SD. Our whole mission is the Agenda for Sustainable Development and working to ensure that it's implemented as widely as possible. We've been given this opportunity to work on COVID as a result of Tedros calling me to see him on January the 31st at the WHO headquarters and saying, can you come along and work with us? And I said, yes, please. We do it on a voluntary basis with WHO. That's the nature of the envoy work. but it is full time, and the whole of our forest team has stopped doing our leadership training and is now working on not just COVID as a public health issue, but COVID, as I've just implied, as an issue that's relevant to the whole of development. John Atkinson, Living Systems Leadership, and works on the systems approach. He's here. Thuy Nguyen, who's our absolutely dedicated communications person, who's also here, who sets up these events, and she's just lit up her video. Catherine Deland, who works with us in the relationships with WHO. She's been a public health lawyer who I've worked with over the years on many, many issues. Joe Colombano, who worked with me when I was in New York on the Sustainable Development Agenda and has come to volunteer to be with us for many weeks at some personal inconvenience to himself. Thank you, Joe. Magali Mahdi, who came from Terre des Hommes and is working on all the scheduling stuff. Sabir Moumen, who's not here, who came from Tunisia and does our administration. Julian Delamontex, who's in Flaine commune and is part of the local authority, the mairie, and is busy dealing with all the issues right now in his commune. Florence Lasbens, who's the managing director of 4SD, who's sitting by my right side and who is actually helping to manage things. Here she is waving to you. There you go. Thank you very much indeed to the whole team for just working together like something amazing. The first question that's come in, what's the difference between this pandemic and previous ones? Thanks very much for that question. We've never had a pandemic due to a coronavirus before. The pandemics, certainly on which I've worked before, have all been due to influenza. And then we've also been working on outbreaks, not pandemics, due to Ebola and related diseases. Just remember, coronavirus is a very difficult virus. Influenzas, they kind of calm down and you move from having had a big influenza, a nasty start. Usually they calm down, they come back in waves. Yes, I'm not going to say influenza is easy. In 1918, influenza was absolutely horrendous. But this is the first ever coronavirus pandemic, and we're learning all the time. This is a virus that's just over 5 months old. There's a lot to learn, particularly on the immunity associated with infection. So all I'm going to say to you is this is completely different. This is a pandemic where there are constant outbreaks springing up all over the place. The only way to deal with it is to contain and suppress outbreaks quickly, not to delay, not to be half-hearted, but to be rapid and robust as soon as you see or sense a possible new outbreak developing. Otherwise, it builds up massively and quickly, and you get caught, and you get a New York or a Northern Italy or a Wuhan. And you don't want that. We've got so many Wuhans now. And some of us were predicting that it wouldn't just be one Wuhan, it would be multiple Wuhans. And unfortunately, the number of big outbreaks has just exceeded all our predictions because governments did not act robustly and quickly. And thank goodness that so many middle income and poor countries did act quickly and did suppress quickly. Simply, that was the right thing to do in order to prevent themselves from being really badly hit. They've been badly hit, but not really badly hit. Whereas still there are some countries that are quite advanced who are perhaps thinking, oh, well, it's not that bad. It's probably being over-exaggerated. And they are struggling, and their people are struggling. And particularly those who are in the high-risk groups are experiencing an awful lot of illness and death. Health workers in particular are in the firing line. Question 2, what lessons have we learned regarding the benefits of global cooperation in preventing and dealing with pandemics? The only way to deal with a global threat like this is to work together. I mean, it's becoming clear. I don't even say it to you as an entreaty. I say it to you as something that is shown through empirical evidence, because many of the really bad explosive outbreaks that have occurred in the last few weeks and months have been in places where there is not cooperation, where there's been political infighting. Either your federal government, your state government, and your local government have been in different political parties and there's been disagreement, or your president has taken a different view from the local administration and said, oh, this is not a problem, and other people are saying, come on, and you get that uncertainty and ambiguity. And when you've got ambiguity inside a government, people are uncertain, the virus goes crazy, and you get an explosive outbreak. It just doesn't work. So if that applies inside countries like in Northern Italy or like in Spain, particularly, I'm choosing those two because we know that was the case, then just imagine what it means if countries don't cooperate in our world. You get problems from medical staff from WHO not being able to go into countries because they can't get permission to enter or because the flights are all mislaid. And you get supplies that are essential for keeping health workers safe and treating people, or getting the tests out, and they can't get across borders because the borders are shut because countries are not cooperating. Or you get differences in approach even within countries like in the Netherlands, or between countries like in Europe, leading the European Union presidents say, come on, why don't you sort it out? So yeah, global and regional and local cooperation brings huge benefits, because when, as in Germany, despite the fact that they're a federal system, there was pretty good cooperation. Just recently, it's slightly kind of been a bit tested. But Germany's, you know, at least they've managed to work hard on keeping political unity. Sweden, absolute consensus politics and everybody agreeing on what to do, absolute. And of course, China, they've just basically said, this is what you do. Singapore, the same. And South Korea, although there's been some political debate, I think there's been incredible cooperation between different political parties. Again, from time to time, it needs some correction. But all I want to say to you is fragmented action means virus has the advantage. Collective, connected, unified action means humanity has the advantage. Stark choice, very clear. Question 3. What do you think are the keys to encourage people to keep fighting against COVID-19 for a long time? But you know, I actually think that that issue is probably going to be the most important issue for us to dwell on, all of us, for the coming weeks and months. You see, this is a simultaneous sense-making behavior change exercise that's relevant for 7.8 billion people, and it's happening at warp speed. And I think the more that we recognize that this is a simultaneous sense-making exercise and understand what sense-making means in terms of people being able to think, read, talk, debate what COVID means in their families, in their communities, in their workplaces, in their local authorities, in their hospitals, the more they can debate and have opportunities to express fear, anger, and then to come to terms with the fact that living with COVID is about living with another risk. We already live with many, many risks in our lives. We come to terms with those risks. We work them through. Every time, those of you who like doing sports, every time we do a sport, whether it's a contact sport or a sport which involves speed, I'll give you 2 examples. Boxing is a contact sport, skiing is or whitewater rafting or whatever. These are sports that involve some risk. But every time we do that activity, we ourselves are making calculations about risks. Our families are making calculations about risks. Our communities are making calculations about risk. It's what we do as humanity. This is a new risk come along, a new one. And I'm one of these ones saying it's not a good one. But I'm also saying that doesn't mean you stop everything. It means you have to make sense of it. And you don't make sense of it in 1 second. It's something that's a constant weighing up and balancing. So I think the key to encouraging people to keep fighting against COVID is simply to say, you're going to have to work out risks, and please keep doing it. But to add to this, governments, local authorities, businesses, trades unions, university administrations, school administrations, they have one job only, and that is to help people work through the risks and to help people find ways to minimize the risks. And if we can keep that right, then that makes it good. Florence on my right-hand side is reminding me that I have a habit. sometimes to talk too much. Here we go. Question 4. Health workers experience burnout, stigma, and lack of relevant education related to COVID, especially in poorer countries. What can be done to address this? This is from Joe. Actually, I've been thinking a lot about this one too, because I've been thinking about colleagues working throughout health systems everywhere, particularly since the beginning of this year, who've just been absolutely flat out. Some of them have come back to work, having left because of family or other reasons. Some have been really upset because they've been already worried about shortages of staff and shortages of cash and poor working conditions. And yeah, burnout or exhaustion is there, quite a lot of mental illness. And in addition, the trauma associated with people having to self-isolate. And yeah, there are challenges about whether they're getting the information and supplies that they're needed. So I'm not going to give an answer in sort of a simple thing, but I do want everybody to understand that as well as applauding health workers for their performance and perhaps giving them medals, we also have to recognize that there are other things that need to be done. Number one, look at the pay structure, because many health workers, particularly women health workers, particularly in roles that are not frontline patient care roles, are paid appallingly badly. So let us just all the time be looking at the pay structure. It's not an unreasonable thing in the middle of a situation like this for there to be serious re-examination of the remuneration. Number two, absolutely important that all supervisors set aside time each week for question and answer sessions with their personnel, even if it's tough to do. Number three, make certain that the recognition that people cannot just go on working 18 hours a day, 7 days a week with relatively little time off and just be able to keep going, especially if they've got children at home and so on. So prioritize the needs of health workers everywhere, but it's not just giving love, it's really recognizing their needs for remuneration, their needs for opportunities to debate and discuss. Number five, when a vaccine is at hand, what steps should be done to address equality of access? Answer, think about equity now. And this is actually beginning to happen, that fortunately, as a result of the Access to COVID Tools Accelerator, which has been launched by WHO, supported by a number of governments and foundations and businesses and the European Union and so on. Absolutely at the center of that is the need for ensuring equity of access. We've got to check. One, is the vaccine sufficiently good? It need not be 100%, but it's got to be good in terms of providing protection. Number two, is it safe? That's absolutely essential to test. And there are going to be some challenges on safety to deal with. Thank you, Joseph, for the question. Number three, make certain that from the start, representatives of governments, representatives of all else involved are thinking, how can we get this to people, the people who need it the most? Thank you, Joseph. Question 6, coming from Paul Rushton in NATO in Brussels. Paul, nice to be in connection with you again. I've got to speed up because of time. With Western countries in the rush to open up their economies have essentially given up on containing further spread. And if quarantine fatigue makes future restrictive measures unlikely, what are the implications for global efforts to contain further waves of this pandemic? Do we essentially accept the fact that some large countries will serve as reservoirs of uncontrolled infection for the foreseeable future? Thank you, Paul. Something I'm thinking about a lot too. Accepting that there will be large countries, possibly wealthy countries, just acting as reservoirs of COVID for the rest of the world. And they're going to go on centrifuging COVID out to the rest of the world for the foreseeable future, is basically accepting that this world is going to be affected by COVID until it's going to be uncontrollably affected by COVID until the vaccine appears. There will be COVID in slums all over the world. There will be COVID preferentially harming poorer people, people who are non-Caucasian, people who are from minority ethnic groups in rich countries. It's basically also creating a huge stress for poor countries. It will almost certainly lead to the economic bankruptcy of poor countries. For me, this give up approach is absolutely unthinkable. And the notion that there are governments that might even be moving in that direction, and Paul, I know why I've asked this question, is also unthinkable. Because yeah, rich countries will find ways to manage it, but poor countries will be knocked sideways by this. We already know from the IMF, this recession is really hitting poor countries very badly. So in answer to your question, giving up is not just bad for the countries themselves, who, as I say, use money to buy their way out of it, but it's just terrible for the poor parts of the world. And it's terrible for poor communities everywhere. So don't give up. And this will be, if I do get a chance to do media this weekend, this will be a point I'll be trying to say. Question 7, what do I recommend at the community level to act and address these revealed inequalities that I described? This is from Dara. Dara, thank you for being on. I actually recognized your face from the session we did yesterday afternoon, which was such fun. Thank you. You know, just all the inequity revelations from COVID should be inspiring each one of us who's committed to public health and equity to work harder to address inequity. And addressing inequity means engaging in political process, not necessarily political parties, but you can't deal with inequity without engaging in power. And so I suppose what it means for me is that it re-inspires me to try to make sure that my work is more tuned to the political necessities when it comes to addressing inequity. Tackling inequity is about getting into the political choices and trade-offs that are made when resources are allocated. It's about remembering that each time you decide that the best way through a problem is to make more people unemployed and to automate your production lines, or to close down more facilities for poor people. Each time you do that, you're just compounding inequity. So we just have to build into all our community work as people committed to public health, an absolute need at every single decision point to think about the opportunities for those who are more income poor and in general who have less power. That's all I can say to you, but Dara, I'm very happy outside of this to continue the dialogue through the multiple mentoring process. Question 8, schools are being encouraged to return, but contact tracing or PPE does not seem to be sought through. This is from Sarah in Nottingham. It does not feel ready. A lot of parents and teachers are scared. In what ways do schools return safely? Thanks for that. I've read about this a lot. You're writing about the UK. What I would like to say is that I understand parents and teachers being scared, but I'd like to turn that fear into a really careful and strategic thinking about just what are the, as I said earlier, vital steps that are necessary, particularly as you come out of lockdown. And so to turn the fear into a discourse about what are the key steps that have to be put in place. Now, the contact tracing part is important. PPE, that really means protection, and that means thinking through about face protection. As I've said so many times before, widespread face protection will become the norm. Of course, there are differences between countries, even between Wales and England, I notice. I know you're in England, Sarah. So look, please, let's just turn the fear and the anxiety into thinking through the vital steps. Please, let's have discussion between parents and teachers about what they can do and get the local authorities involved if possible. Try not to get too angry because everybody in Britain is confused and it'll take 2 or 3 weeks for that confusion to sort out. But I'm rather keen that you don't get paralyzed by fear, but instead you use the fear to think through the vital steps and discuss them. Question 9, we hear of blood clots, kidney damage, even COVID toe. To what extent do you think people realize the full extent of this disease? What are the possible long-term implications of this? This is from David Salinas in Geneva. Hello, David. Yeah, as I said at the beginning, this is a dangerous, stealthy, and surprising virus. And we're seeing that it presents with a variety of different disease patterns, including blood clotting. I think that a lot of this is due to the way in which the body, the host, reacts to the virus. There seems to be big variety in the way in which different individuals react. In some cases, the host reaction leads to blood clotting, and to some extent, the host reaction may lead to the funny COVID toe, and in many people, there's also the loss of the sense of smell. So I keep reminding myself that the virus leads to different illnesses in different people. And I believe that we're going to find more and more and more aspects of this disease. You didn't mention the chronic fatigue that some people are seeing and are writing about. And so, yep, there are many, many long-term implications of this disease. It's back to my earlier point. Don't treat it lightly. We're finding out more and more. And if you've got odd symptoms, even if you test negative and you just don't know what's going on, and it's not like any illness you've ever had before, just keep a little note of it. Keep a little note of it, because even in my own family, I believe there are people who've got COVID, who've tested negative, who've got really weird symptoms, particularly the exhaustion and the tiredness and bad headaches. And just keep talking about it and thinking about it and sharing. Question 10, speeding up. Can you recommend some links or networks working on rights of older adults to address equality, community and hospital care in the midst of COVID-19 so that older adults can come out better? Joseph, thank you. Got a colleague called Annie Feltham who is writing about rights of older people. Joseph, I'm going to try to get some of her writing and material available, because I actually think that this might be helpful to you. We're going to test to see that. I've got a colleague, Mary Mananda, in the World Health Organization, who's working on the decade of older people. I want to be sure that we can connect you to it. I want to find ways to get you the resources. We'll try to find a way on the 4ST website to get that to you, or if you connect in subsequent sessions, but the team are saying, because I'm getting signals, we'll connect with you, Joseph, on this. And Joseph, thank you always for joining us from Philippines. I know where you are. Normally I explain where people are joining from. I haven't done so today, but we have got people from very, very far west of here, very far east of here. And Joseph, our wonderful friend who you can see, I don't know whether you can see him there. He's outside his house with a tree behind him. Joseph from Philippines, give us a wave. It's lovely to see you. Thank you very much indeed. Question 11, thank you. How do you see world leaders coming together to take necessary political decisions where there now appears to be a political vacuum? How can we ensure that no one is left behind? Well, I was just talking with the One campaign, Marianne, just a couple of days ago through a thing called Tortoise. I kind of sense we're going to see over the next few weeks, and I don't think there'll be very many, the emergence of a petition of many millions of people throughout the world just calling on world leaders to stop it and to start behaving and to really show what leadership means. Leadership means coming together in a time of need and difficulty. That's the only way it can be done. Can't just do it by appealing to them and saying, you should be doing this. There are many, many great people internationally who are asking world leaders to just work together, but the leaders concerned, like in a sort of marital dispute, they're basically either side sees that they're in the right and they're not just ready to stop. But again, as in a marital dispute, if the children shout loud enough, then the parents might calm down. And perhaps that's what's going to happen, because there's no arbitration in this. And I think it's the people of the world are going to have to get leaders to just be accountable. And I want to see a petition of 500 million people calling on world leaders to actually work together and to stop their disputes, because this bickering between world leaders is not going to make life any better for anybody. It's going to make life worse for hundreds of millions and billions of people. So I'm working for that. I'm working for a public petition for world leaders simply to work together. And I want that petition to be so strong so that actually those who are behind the bickering leaders will realize that their interests are damaged if they go on bickering. If not, then we have to create alternative leadership. And perhaps that's what's going to happen. But it won't be presidents and prime ministers. It'll be people's leadership. Question 12. What are your thoughts on COVID and governance? What's the future of multilateral organizations? Same subject. Currently, they are, I can't read that. Lauded and disguised. Lena, I'm trying to work out because I can't quite, would they get strengthened or weakened? Now I get the point, what is needed. So Lena, of course, this is Lena Mahi who's written, she actually does work within the World Health Organization, and like Lena, like me, we're proud to be involved in the World Health Organization, proud to be part of the global public health community, proud to be working for what we stand for. Just Tracy sent a text, I just saw it because my mind slipped. Is there a petition currently? Yes, there is. We'll try to find a way. It's through the One campaign. Sorry? Twee's going to post it up on the chat. So Lena, yeah, we're both proud to be involved in equity and public health. I personally believe that through this, multilateralism will be strengthened. Right now, multilateralism is being weakened. And we're going to have a worse time in the coming days. I think that there could be challenges at the World Health Assembly because simply member states are bickering over a resolution using all their old tricks. But I think that the public will demand proper multilateralism that respects the first 3 words of the UN Charter. Those are we the peoples. This multilateral system was created after 1945, not for governments, but for people. It was for people of the world, but it's behaving right now as though it's there as a tool for governments for their own disputes. So what we will have as a result of this, I'm absolutely convinced of it, is a multilateral system that works for people, that is not hijacked by governments. It'll take time to sort it out, but it will come. You work in nutrition. You work for equity in nutrition. You work for the well-being of people. You've done it all your professional life. You need to be able to do this without all the time having your work interrupted because of bickering between governments or between proxies for governments. So I think this will lead to stronger multilateralism. Yes. And I don't think I'm being wishy-washy here. I actually believe this will happen. And I think there are many of us who will find ourselves contributing to it, including you. This is from Raushana in Geneva. Welcome, welcome, Raushana. Thank you for joining. We keep hearing that just as many people die from the flu each year, and this isn't really that bad. What do you think? I'm just going to say one sentence. This virus is much more dangerous than the flu. Simple. Much more dangerous than the flu. And so anybody who says it's just like flu, they're wrong. Okay? Question 14. I know you, Raushana, you asked that just to get me to say those words, so I've said those words. And please tweet, explain, share, just keep saying it. This is more dangerous than the flu, and we're finding out how dangerous it is all the time. Question 14. How do we better communicate a systems approach to busy, harassed decision makers? This is from Chris, Think the Unthinkable UK. I actually think that decision makers more and more are realizing that unless you have a systems approach and shift away from linear approaches to complex issues, unless you have a systems approach, you get it wrong. And our colleague John and myself and all the rest of us in 4SD are finding more and more people saying to us, we want to do good decisions, we have to use a systems approach. And they're also recognizing it has to be a systems approach that's not mechanical systems, or not even using the metaphors of mechanical systems like leverage or pressure points or whatever other language that's used. Living systems are about people in systems. It's about understanding that people act very much through their emotions as well as through their reasoning. So it's a people-centered living systems approach that's the only way to go. And I'm finding, Chris, that more and more and more leaders are saying this. Well, over time, we're going to extend, because we've had more questions than ever before on this. We've also got more people on this than ever before. So I am finding that decision makers in government, in business, in civil society, in the trades union movement, particularly, are recognizing that because life is about interconnected systems that through their interplay impact on the lives of individuals, impact on life in nature, impact on the planet and on the climate, because they're recognizing this more and more, they're actually wanting to learn to be living systems thinkers and living systems workers. I think, Chris, your challenge in thinking the unthinkable, our challenge in 4SD is to be able to present systems thinking so that it's not scary, so that it's not something that people feel, oh my goodness, I'm going to have to completely readjust the way in which my brain works to get into this. And instead, present it as something that is straightforward. It's not requiring a complete mental conversion. And I hope that through your work in thinking the unthinkable and our work with John and others in 4SD, we can find a way to make it easier for everybody everywhere to slide into systems thinking, and in particular, living systems thinking or human-centered systems thinking. And that is, I think, our challenge, and it's what we're trying to do, even as we're working on COVID, which requires systems thinking at all levels, systems leadership at all levels. We hope that we will be able to bring more and more people to an understanding of the value of doing this, and to do it without it being a really scary thing. Perhaps that's what I think I've got most focused on recently, is trying to make sure that people see that it's not actually scary. It becomes a huge relief when you let your mind shift away from linear thinking, for every problem there's a simple solution, to the more systems thinking. We're saying, well, for every problem, actually there are multiple processes that are working together to influence that problem. We have to look at those processes in terms of people, in terms of places, in terms of various different interactions that occur, and it's not so hard. I'm very impressed, Chris, with one of the spotlights that we put on the 4SD website recently by Karina Hawkes, who talks about particularly food from a systems perspective. And she's also trying through that to help people find their way into it. Those of you who've got a second or two to read it, please do so. Karina Hawkes, she's called. She's at City University in London, and very, very, very beautiful thinker. Question 15, why do you believe One Health is not getting more specific and daily attention now? This is from Karen Kaplan in the United States. Hello, Karen. The One Health movement was developed in about 2003, 2004 by a group led by the Wildlife Conservation Society. They had a meeting actually near where you are, in which they developed what we call the Manhattan Principles, very different from the Manhattan Project, by the way. The Manhattan Principles were a way of bringing together thinking about human health, animal health, and environmental health, and creating a unitary discipline, not least to be prepared for zoonotic diseases, exactly like the COVID. I think it is getting more attention. In certain countries, it's actually part of the DNA of national government, particularly countries that were affected by avian influenza in 2005, 2006, so in Thailand, in Indonesia. There are challenges. The culture of human health people and the culture of veterinary health people, the culture of environmental health people, are not exactly the same. And whenever you're dealing with trying to bring together different professional disciplines, you're also trying to bring together different cultures. And so it's not been easy, but I'm so pleased that the US National Academy of Sciences based in Washington, has actually really embraced One Health. And Peter Daszak, who leads the Forum on Microbial Threats in the US, together with a number of people from UC Davis and other places in the US, linking up with people in Nigeria and in East Asia, as I said, and in India, have really begun to see One Health rising up. But as you say, it probably should be getting more attention, and I'm absolutely certain that it will in the coming weeks and months, particularly following the introduction of COVID into the new coronavirus into our livelihoods. So thanks for reminding us about One Health, Karen. That's great. Question 15 comes from Joe Nichols, based in moment in Nairobi, working in Somalia. It's quite a long question, so I'll actually read it because I think the question contains some observations. Inequities in between countries are stark. Only 30% of children aged 6 to 13 in Somalia are enrolled in school, whether formal or informal schools, even in normal times. Now, most schools are closed. And when they're opened, there won't be capacity to reorganize and create space for physical distancing. Some of the schools already do 2 shifts of learning each day. It's hard to see how a solution, even with ingenious community ideas, will keep people safe, especially when kids go home. Because they go home in Somalia to large intergenerational families. There's very high family size in Somalia of just under 7. There's also a lot of stigma in East African countries. Joe notices Somalia and Kenya, which makes living with COVID harder. What solutions do you see? Of course, the way in which you've expressed that, Joe, means that inevitably I have to say back to you that from where I'm sitting in comfort of Ferney-Voltaire in France, it's kind of totally inappropriate to be offering prescriptions, and anyway, you know I wouldn't do that. But I want to stress to you that just as humanity had to come to terms with the risks associated with sexual transmission of HIV and AIDS, just in a similar way, I believe that humanity will make sense of the risks associated with COVID. And there may well be an acceptance that in certain societies, it's not possible for people to keep safe, in inverted commas, in an absolute sense, but they will work through ways within their own circumstances of trying to limit the risk. And they may decide that anyway, the risk of COVID is something they're going to live with because they've got much worse issues to deal with. For example, periodical droughts or floods, food shortage, violence, and other aspects of disturbance to life that they will see as perhaps more serious than COVID. There's going to have to be sense making about this. There's going to have to be the working through of the risks in each individual community, and it will take time. And you've mentioned to me, Joe, that in Somalia, there's a very vibrant culture of discussion within communities, or using radio phone-in shows, because so many people have got mobile phones, not smartphones, but mobile phones, and they ring in and they talk to each other over the radio. And you've been the person who's reminded me of the importance of dialogue to make sense of things in every society, every workplace. And so following what you told me, I then have spoken to people who are in the cell phone association, the GSM association, who were focusing initially on using cell phones as a way of broadcasting messages to people, or using cell phones as a way to communicate with people for contact tracing. And I said, voice matters. People need to be able to talk, and they need to be able to talk everywhere in the world. And creating an opportunity for them to talk is vital. And so my friend, who hadn't thought about this, the head of the GSM association, after I told him about what you'd written to me, he said, that's an important point. And we'll start to share with our members that it's not just digital that matters, but it's voice that matters, and keeping the cost of voice down in places where perhaps there's not a lot of smartphone use may be really important. So thank you, Joe, for sharing this message. Thank you for reminding us that sense making in poor communities is so difficult. And I just wanted to feed back to you that your sharing with me gave me a chance to share with Max Granrid, who's the CEO of the GSM Association, the absolute need for people to be able to talk, share, ask questions, have facilitation, because the sense making is the key to working through the balance of risks that we will all have to live with. And that's not just in Somalia. It's not just in Kenya. It is everywhere. Sense making by 7.8 billion people. None of us, me or anybody else, we can't prescribe this. We have to facilitate that process happening. And that then brings me, gosh, how these things run together, to question 17. There's been very little effective public communication about risk. So often the communication is about absolute risk. It's about keeping safe. No one really knows about how to work through the relative risk. For example, adults in public transport. For example, the risks of children passing it in schools that are opening up. Is there any good data on risk? And then the final thing in brackets is relative or absolute. And that's from Nancy Medley. And the term that's so important in here is relative, weighing up risk in different circumstances. Increasingly, I'm being asked, is it safe to travel on the London subway when people are crammed together in rush hour, especially if people haven't got face coverings? And it can't be answered in an absolute sense. It all depends. Is somebody else on the subway likely to be on there with COVID? Are you going to end up likely to be standing close to them? Are they going to be likely to be covering their face properly and doing cough etiquette or not? And of course, we've heard of a very, very unfortunate situation of a worker in the London Underground who was coughed at and spat at by somebody who said, and I've got COVID, and that person went on to die. And of course, that story, which was in the UK newspapers yesterday, is going to haunt us all. Gosh, if she could die, then any one of us might be at risk. And risk, it's so many different factors. What is the likelihood that someone with COVID is going to actually be close to me on public transport? What is the likelihood that that person is or is not going to be covering themselves? What is the likelihood that I'm then going to get the COVID transmitted to me? What is the likelihood that if I get COVID, I'm going to go on and get seriously ill or die? And in each of those different chains, there are a whole stack of probabilities. And I actually think that quite often, the actual risk for us as individuals is really, really small. But the risk that something is going to happen on the London Underground during an hour in terms of numbers of COVID transmissions is probably relatively high. And there will be COVID transmissions. Yeah. But will I or somebody else actually be at risk as a result of getting the COVID? Very, very, very low. And if we're not in the subway, but if we're out in the open and we're gathered together watching a football match or something, very, very, very low. And it's that thinking through the likelihood that an event will happen to someone versus the likelihood that it will happen to me. That's where it gets very, very interesting. Yeah, it's two things. It's data you need for that, but it's also working it out and working it through. Not with mathematical models, but to thinking through the risk causality, the risk pattern, and trying to relate it to ourselves. I can't give you, Nancy, a beautiful answer. I mean, yeah, there's one guy who happens to be a fellow of the Royal Society and who I've worked with over the years, who I think is the best on risk in the world, called Chris Dye. And perhaps as a result of this, I will ask him, does he know anywhere where this is available? And we'll try to write a narrative about it. So I've run over time. So sorry, 15 minutes. Sorry to the team and everybody else, but this has been a particularly interesting online briefing, particularly interesting because I enjoyed preparing for it. I spent quite a lot of time yesterday and early this morning thinking it through and discussing it with colleagues, and super fun talking with you, and lovely to see people who I haven't seen for quite some time joining for the first time. Welcome, welcome, welcome. And to everybody else, please keep joining us, please keep sharing. Let's keep ourselves making sense of what is happening. This is an event like no other. And with that, I thank everybody who's been involved in making this possible. Particularly want to thank Florence, who is out of my right eye and who sends messages through body language very, very efficiently. And we're saying time to wrap up now. And I will wrap up. I won't do the usual talking with you, and but I can't resist it, just saying hello to a couple of people. So that's the end now. I'd like to say hello to my daughter Polly, who's there on her husband's computer. Thank you very much indeed. And there is my grandson, Isaac, on the little car that we brought for him at the end of the corridor. Hello, Isaac. Hello, Polly. Just want to say hello to Sarah, who often is waving to Isaac on these calls. Lovely to see you. I do want to say how delighted I am that Roshana's here. Thank you for joining. I'm sorry I didn't give you much notice. Hello to Aloysius Arrigo. It's lovely to see you and looking well. Thank you very much for being here. Marianne, you're a tonic. You're just there, and I see you in the corner of your room, and you always send in lovely questions. Please don't hesitate to go on writing. Thank you for your emails. They really make a lot of difference. Dara, thank you. Joseph, stay well in the Philippines and keep close to keep your family well and yourself well. And I know that tough times. Joe, thank you for joining, sending us the message from Somalia. So important. So important what you're doing. Brian, thank you for joining. Brian Jenkins it is. And then Abdul Samid, I'm not sure whether you've been on before, but it's lovely. Tracy joining from the US, thank you for being with us. I think US or Canada, anyway, from the East Coast. To Karen Kaplan, really, really good. Chris from Thinking the Unthinkable, we've done some lovely stuff together. Hilke, thank you for being with us. It's really good. Philip, so glad you're here. And to everybody, have a good rest of the day. And if you want to tune in again, we'll be doing this again next Tuesday at 5 p.m. European. And if you've got ideas for what we should do, just let us know. And meanwhile, Isaac waving away there. Isaac, you're part of, the whole thing is working for you and for you and for your friends and for your cousins and the little one who's about to come as well on his project. So thanks a lot. Bye-bye all. Bye.